Okay, so hello everyone. I'm Miguel Saura. Welcome once again to our webinars. This will be a very special webinar because we will have the participation of Christopher Bedford, one of the first users of Nesplora in the United States. But before I introduce him, if you are new here, I would like to point out that you have available other webinars and more info at nesplora.com. You can access it from the main page, or you can ask us by the email customer@nesplora.com, or also through all our social media. So no more waiting. He's counseling psychologist, therapist, also earned a postdoctoral master's degree in clinical psychopharmacology, and executive director of the American Board of School Neuropsychology. Thank you very much for participating and welcome to this webinar, Christopher.
Yeah, thank you for having me. I'm really happy to be here.
First of all, I admire your work as a clinician and communicator. Where did you get to your training? How did you get to where you are now?
Sure. So I started out actually studying counseling psychology. I did a doctoral degree in counseling psychology at the University of Minnesota in the United States. And I was probably about 2/3 of the way through that training program when I met an alumnus of the program who worked for an industrial organizational consulting firm. So they did a lot of executive assessment work, helping corporations make good hires, figuring out kind of who's going to be their best candidates. And up until that point, my experience with assessment was really just one single class in personality assessment, basically a class about the MMPI. And I went and did what was supposed to be one summer of an internship at this industrial organizational consulting firm, which turned into a multi-year relationship with them. But it was also my first exposure to doing real assessment work. And I really enjoyed it. I really enjoyed gathering the data. For the kind of work we were doing there, it was some problem-solving abilities, it was personality assessment, it was some work simulations. And I really liked pulling all that information together and figuring out how do we weave together a narrative that helps us understand what this person's strengths and weaknesses are. About the time that I was finishing my doctoral degree, though, I was trying to think about what do I want to do long term, and do I want to continue doing executive assessment work and helping large corporations hire better managers and better executives? And ultimately, that wasn't super satisfying for me. So I started looking around for postdoctoral opportunities and ended up finding myself at a place called the Clinic for Attention, Learning, and Memory in Minneapolis. I spent some time there as a postdoc, got myself licensed as a licensed psychologist in Minnesota. And in 2017, after I'd been there for several years, I started my own solo practice. And so in my practice, it's very much what I was doing at that previous clinic. I see people who are struggling with issues around attention, learning, and memory. Lots of students, pretty much everyone I work with is a student in some form or another, someplace between maybe first or second grade all the way through college and graduate school. Often they have concerns about attention, or they have concerns about reading, writing, math, something like that, executive functioning issues. And I decided when I was going to start my own practice that I wanted to kind of, do everything myself. Where I had been, we had psychometrists who did the testing for us, and I was ready to do things a little bit differently and wanted to do all my own testing, wanted to go out and try to find the best tools that I could find, and stumbled my way to finding Nesplora, and we can talk about that in a few minutes, I'm pretty sure. But at this point, I see clients in my solo practice. The other things that I'm involved in are professionally I'm an associate director at the School Neuropsychology Institute. It's a continuing education organization. We provide a variety of different sorts of training, but kind of the flagship program we have is a 10-month-long training program that trains psychologists, mostly school psychologists, but also clinical and counseling psychologists, to use neuropsychological instruments in their evaluations. And for some people, this is a huge watershed change in the way that they do assessment work, and teach them how to look at things like executive functioning and attention in a deeper way, and how to incorporate more memory testing into the work we're doing with students, things like that. The third thing that I do, which is related to that on some level, is I'm the executive director for the American Board of School Neuropsychology. We're a credentialing board, and often people who graduate from that training program will go on to become board certified school neuropsychologists. Other people will come to the board directly and talk about the experience they have and go through the process of the examination and the presentation of a case to become board certified. So I've kind of a few different things going all the time, it feels like, but I love the variety and I really love what I do. So
I can notice it because I also want to congratulate you for the chapter assessing and interviewing with children with ADHD in the book Best Practice in School Neuropsychology, where you talk about Nesplora. How did you meet us?
Yeah, so that was a project that came out of COVID. So this is the second edition of the Best Practices in School Neuropsychology. The first edition was published, I want to say, in 2010, if I remember right. And COVID happened, and all of a sudden, my private practice was really slow. I didn't have very many people coming in to do evaluations in the midst of a pandemic, and we started talking about things that we could do that would be helpful and useful. And the idea came up, well, maybe we should do a second revision of that book. And so Dan Miller, Denise Miracle, Julie Getman, and I are the 4 editors for that text. It's 32 chapters, I believe, 33 chapters, something like that. And among them is a chapter that I wrote about assessing children with ADHD. What sorts of assessment techniques do you want to use? What sorts of interventions are appropriate? How can we do, the best sort of work with those kids as we can? It's a great book, though. It also looks at assessing for different learning disabilities and working with children with low vision and blindness and deaf and hard of hearing children. There are chapters on things like measuring effort in testing, all kinds of stuff. It's a great resource. It's not the kind of book that you're probably going to sit down and read, cover to cover. It's the kind of thing you're going to pull out as a resource. It's more of a desk reference than it is a, nighttime reading or bedstand reading or anything like that. But
yeah, I think so. For consultations and everything, I like the chapter very much because you address ADHD in a very complex way. At the beginning of the chapter, you mentioned the prevalence in the USA and common aspect about the most diagnosed subtype. Do you think that the lack of method in diagnosis could be a problem? How do you think it can be improved?
I missed a little bit of that. I'm sorry.
About the prevalence of ADHD. Mm-hmm. Do you think that the lack of method in the diagnosis could be a problem in USA? How do you think it can be improved?
I think it could definitely be improved. I think what happens a lot in the United States, and not everybody needs what I'm about to say, but a lot of what happens in the United States is a lot of children and adolescents are diagnosed with ADHD in a pediatrician's office based on a couple of rating scales. And for a lot of people, that might be completely okay, and they may be accurately diagnosed using that approach. At the same time, my pretty firm belief is that an awful lot of things cause attention symptoms. Medical conditions like, sleep disorders and anxiety and depression, and other sorts of genetic conditions, all sorts of things will impact our attention. At one point, back with the previous version of the DSM, I did a count of the number of different disorders that had attention problems as part of the symptomology, and it was something like 7 or 8 different diagnoses. And I think one of the things that happens potentially is some people get diagnosed who don't actually have ADHD. At the same time, we know that there are other people who aren't getting diagnosed, who it's getting missed. Not exclusively is that young women, but we see in younger women more of an inattentive presentation that sometimes gets overlooked or mischaracterized as them being daydreamy or just in their own head, something like that. And we don't necessarily recognize that it is ADHD. That's where I think personally, doing a more in-depth, broader evaluation helps us figure out what here is related to ADHD and which of these attention problems are maybe actually the consequence of something else. There's a pretty big part of me, honestly, that doesn't care too much what we call anything. I'm not too concerned about diagnostic labels in an awful lot of ways. They definitely have utility in as much as they provide access to services and they provide access to different interventions like medications and things like that. So they're important. But much more important to me as a practitioner, and I usually tell families this at the beginning of my work with them, I'm much more interested in figuring out what you're good at, what's hard for you, and how do we make the hard stuff easier. Honestly, most of the people I work with don't fit neatly into any of those categories. We're almost always shoehorning people in a little bit here or there. I mean, I think about like the onset before the age of 12 criteria for ADHD in the DSM, and that might be a good threshold for some people, but in my experience and in some of the research I've read, we know that really bright people can often hold it together and maybe can get by on intellectual horsepower alone through high school even, or at least through middle school, and then they're over the age of 12 when the symptoms start to manifest, even though on some level they've been combating them for a long time, just not in an obvious way to those around them. So I don't want to say that I completely disregard the DSM. I pay attention to it, but I also take it with a bit of a grain of salt, where I want to make sure that I'm not, a slave to counting symptoms, but rather I'm figuring out big picture, what's actually going on with this person and what's going to be helpful.
I totally agree. I think that it's not it's also about assessing complete function, for example, attention. What do you think, which role play Aula or Aquarium as tools for this method?
Sorry, say that one more time about the very last part about...
Which role do you think that Aula or Aquarium play in this method?
For me personally, it's one of the cornerstones of the evaluations I do when I'm looking at ADHD. It's usually the first thing I have people do after the intake session. So I usually do an intake and testing on the same day. Most of my big evaluations, the broad comprehensive evaluations I do, usually happen over the course of 3 days. And so we'll sit down on the first day and in 3 half days. I'm not like working with kids for 24 hours. It's more like 9 hours, 3-hour sessions. But the first session, we'll spend about an hour doing the intake. And then the first thing I usually have people do after that is the VR test. Whether it's Aula for kids or whether it's Aquarium for older adolescents and adults, that's usually the very first thing. In part because it gives me, a good baseline of understanding sort of what they might be like to work with going forward. But it's a nice introduction. It's something that's unique. It's something that is pretty engaging for a lot of people, something they haven't done. And especially, and this might sound silly in some ways, but especially for the children and adolescents I work with, I think it builds a little bit of credibility for me with them, that I might be, somebody that's going to do something interesting or different with them. And sometimes with younger kids, what that turns into is that VR becomes kind of a reward at the end of other sessions where we'll let them play, a game of Beat Saber or something like that as a way of kind of, something to work towards as they're working through the process.
Like being an immersive test with a classroom full of children and realistic distractor, do you have any anecdote with the patient? Any fun moment with the patient doing the evaluation?
No, I haven't. I haven't had any problems with people who have VR sickness or get dizzy or anything like that. That's always gone really, really smoothly. Now, I've had people complain that it's boring. I've had people telling me that they don't want it, that asking when they're going to be done. But some of those same people who want to know they're going to be done with that task are eager to do other things that are more game-like, or that are actual games rather. But I think that's exactly what we expect to have happen, right? With kids who have attention issues, we're trying to put them in this kind of tedious situation to see if they can pay attention when things are not optimal. Because most of us, honestly, I like the connotation that a few authors write about, that people with ADHD don't necessarily have problems with attention per se. They have problems directing their attention to where it needs to be in the moment. And so, some of the kids I work with don't have any trouble attending to the things they really care about, whether those things are video games or a little girl I had in last week who just loves to read. And if she gets to read what she wants to, she can stay tuned into that for a really long time. But the bigger problem is, can she direct her attention to what she needs to direct it to in the moment? And she really struggled with Nesplora. She had a really, really hard time, really all around. Omission errors, commission errors, auditory, visual, high stimulation, low stimulation, and then, tracking her head movement, it was all over the place. It was, he was one of the kids who, and some of my colleagues would tell me that I'm ridiculous for doing this, but I put kids they sit in spinny chairs in my office. They sit in like rotating chairs. I don't know what you call them in Spain, but they sit at typical desk chairs where they can turn around. And that one part of Aula where the teacher walks down one aisle, behind the student and up the other aisle, I love it when I can watch a kid spin all the way around in their chair, watching the teacher the whole time, knowing that in those moments they're also missing visual targets on the board. But it tells me a lot, in addition to the rating scales that I get or the norm scores I get, it tells me a lot about what sorts of things are they responding to? How are they, how are they managing in the real world? And that for me with Nesplora is the real beauty of it, is that it much more mimics the classroom environment than the IVA. I used to use the IVA at my old practice, the group practice I was at, and I don't have any problems with it. I think it's a good instrument, but I think the differences between sitting at a computer with a mouse clicking when you see a 1 and not when you see a 2, it may be a good measure of attention in a lot of ways, but it's not the same as, I think, putting them into this virtual environment where not only do we have targets and non-targets, but we also have the distractions of a typical classroom, of the ability to, have classmates trying to get your attention. I have kids talk to me all the time during the test and say, somebody's trying to get me to turn around. They're trying to, they're whispering to me. And, I think that really speaks to their experience in the classroom. I've never had kids do this, taking the IVA in the 6 or 7 years that I used that test. I have had kids here who are so impulsive that they're talking to the characters, their classmates and the teacher, as if they're real people there. And that also is telling me something, like from a qualitative perspective, about them blurting out, their ability to inhibit and be quiet, because nobody's talking to the 1s and 2s on the screen when they're doing the IVA or the TOVA or any of those things. But here, they actually really engage with the environment.
I think that all of this is super important for not only obtain numbers, also quality information, and also not for moving to adults. I think that it's difficult to diagnose adults with attentional problem because they mask their performance or compensity. What do you think about Aquarium in this case? What do you like most about it?
I think Aquarium is a great instrument. I really like it. Over the course of, I would say prior to COVID, 85% of my clients were students, someplace between kindergarten and college. Those numbers have gone down a bit because the number of adults I've been working with over the course of the pandemic has really increased. Probably 30% of my clients are adults now. And it used to be the clients I worked with who were adults were usually the parents of children that I had evaluated. And during the feedback process, they would say, oh, this sounds just like me. Do you do this with adults? And I say, yeah, I do it with adults, but it's usually shorter. It's more targeted. I'm not going to make you do math and reading and writing, but we're going to look at a lot of the same big picture things. Over the course of the pandemic, I had an awful lot of adults starting to come out of the woodwork saying, I think that I might have ADHD. And some of them do. And some of them just struggle to work at home virtually, but some of them do. And almost across the board, they're really, really bright people. I'm getting a lot of really bright adults who probably were smart enough, and even by their own estimation, when they talk about their background and history, they got through college and high school on horsepower. That they were smart enough that they could do what they needed to do to get stuff done. Did a lot of stuff last minute, pulled it together, was smart enough to write a good paper in one night, and that worked for them. But what they're finding is, now I'm in the work world, there's less structure, there's less scaffolding, the demands and expectations are higher, and I feel like I'm having a harder time getting things done. And then they may also be balancing that with a spouse and kids and all this other stuff. And so aquarium, I really like because it's really challenging. It's not just click when you see this fish and don't click when you see any of the other fish. It's, click when you see this fish, but only if you've heard or seen this fish before. And so we get that working memory component into it. And I think by making it that difficult, we get better measurements of real abilities. It gets closer to mimicking how do I juggle all the competing demands that I have in the real world. There's a meta-analysis out there from, I think, 2011, published by Park and colleagues. They're from South Korea. And what they write about is how high IQ can attenuate performance on these tasks. And so sometimes we're not catching really, really exceptionally bright people with these tasks because they're only 20 minutes long or so. And I think that's definitely true. We're still seeing that, but I think I potentially see that a lot less with aquarium than I did elsewhere because aquarium adds that extra layer of difficulty. I also like the switching component of it. I think that also reflects real world, like work environment situations, like where I'm working on this task right now, then I need to switch to this other thing, and how easily can I make that transition? So I like looking at the perseveration scores. I like looking at how easily do they adapt to the new instructions. The same thing with, the distractibility pieces are still in there. There aren't quite as many of them, I don't think, but, you still get like the phone ringing, the baby crying, the woman stopping in front of you, and, how does that go? And again, I also have people muttering to themselves or narrating their experience while they're doing it and trying to come up with strategies for how am I going to do this? And I hear them rehearsing, subvocally, what the rules were, trying to internalize them, and I can tell just how hard they're working. And sometimes that's particularly important for those people that are really bright, who maybe the norm scores ultimately look more or less okay, they're kind of on the cusp, but then when I think about like how hard they had to work to do that, and how smart are they, that all of a sudden it starts to look more and more like, yeah, this might be something like if we'd made this an extra 20 minutes longer, which I don't think I'd recommend, but if we doubled the length of this task, would that person have gotten into the clinical range? And for some of them, I think they would. And so I find myself not always looking just at the scores, but looking at, the performance on this in conjunction with observations while they're doing it, as well as other data that I have about them in terms of intellectual ability, problem-solving ability, other executive functioning skills that I might measure with something like the DCEFs, and how do those overlap with performance I see on Aula and Aquarium. So it's part of a big package, and it really, I think it complements the rest of my evaluation in a way that is more complete and more helpful than other CPTs I've used in the past.
Not also, you mentioned the tools you need for assessing the attention. You also mentioned in the chapter of the book, the treatment. For example, here in Spain, actually Europe, science project originated from there. Because there is not learning effect, psychiatrists use Aula and Aquarium to monitor treatment. How is treatment monitored there in the United States? How is your method for that?
I would say I do that less with adults, but I do it frequently with children, where I'll offer, since it's a short test, I'll often offer, like, if you decide you want to try meds or you want to try whatever interventions you want to try, let me know after you've kind of used them for a little while. And if you feel like it's going great, that's fine. Just keep doing it. But if you're not sure, or if you're, or sometimes I get parents who are really nervous about trying to medicate their children for ADHD. I'll let them know, like, you can come in. I won't charge you anything. It's only going to take us about, we'll spend 40 minutes together total. Come in, tell me how things are going. We'll have them do the test on medication. And then we'll spend 10 minutes talking about it afterwards and compare and contrast it to what we saw before and see how that fits with your observations. And I've had some families where that is really reassuring to them that, oh, we can do that. We can get some quantitative measurement of it too. And we can talk about, any side effects that might be going on with medication, things like that. But that's been really helpful. I've had a couple of families who have done that several times because the medication they chose the first time actually made symptoms worse. And they kind of knew it was making symptoms worse. They knew that the child was getting more irritable and agitated on that medication. And it felt like things were getting, out of hand. And I'm thinking about one family in particular where they came in and they did it on Concerta after the evaluation and performance was worse. They switched over and tried Strattera, a non-stimulant medication. And that took a while to build up in the system, but they came in and tried that and it was really, really effective for them. So being able to quantify that really, I think, puts some people at ease and makes them feel more comfortable with, the decisions they're making about interventions and how they go about doing all that.
Great. Also, going on to other tests, for example, a year ago, we also released ice cream to measure executive function. What do you think about it?
I've been using ice cream a lot with the children and adolescents I work with. And what I like about it is I like the switching in the middle. That, it's something that, I recognize that the rules change in the middle of Aula too, in terms of what you're responding to, but it changes so dramatically that I think it's an easier transition to make. From, you're clicking on everything but the apples and now you're clicking on only the sevens. It's a really dramatic difference. I think the more subtle change that's incorporated into ice cream, gives you a better sense as to how perceptive are they and how easy it is for them to make those changes. The other things that I like about it is I really like the processing measurement, the processing speed measurement, how quickly can they do these things. And I like that because I have a lot of people who I use the Wechsler instruments for most of my testing, and I have a lot of people that do totally fine on the processing speed index. They can do coding and they can do symbol search, but they might complain about how difficult it is for them to get a test done on time or to finish their math homework or whatever it might be. And if you would only look at the processing speed index, you would say, oh, they don't need extended time, they're totally fine. I find that data like what I get from ice cream, I also look at how long does it take them to do stuff on like the Tower Test on the DCAFs, that those measurements give me some insight into if we put you into a more cognitively demanding situation, how fast can you do things? And for me, that's a better reflection of their processing speed demands for a math exam or for a standardized test that they might need to take. And it tells me a lot more, I think, about the necessity for potential extended time. So I like that a lot. And I also really like looking on ice cream at how often are people referring back to the recipe book. Because I'll get people who are really slow. It takes them a long time to do it, but one of the reasons it takes them a long time to do it is because they are referring back to the book all the time. And then the question is that because they don't have a strategy for encoding the recipes into their head? Is it because they're overly anxious and nervous about making mistakes, so they want to, just be 100% sure? And some of that we can't necessarily tease out just by looking at the scores, but some of that we can tease out through conversation with them afterwards, by talking with them about how homework goes or how they perform at school. And it provides some data points that, in the big picture of everything, help us to understand how does this person function? What drives them? What's going to help them get things done? How do we help them to be more efficient? And, so like I'll compare some of that performance, for example, to the memory battery that I'll do to see, do you actually have better memory than you think you do? Maybe you don't need to look at the recipe book every single time. Based on what we see in the RAML, you could probably encode that. And likewise, we'll see people who never refer back to it and do really well. And sometimes I'll have conversations with them afterwards about so how'd you do that? What strategy or technique did you do for learning the recipes the first time? And how did you learn the subtle change in recipes in the midway point? What strategy did you use? And it tells me a lot. And what's interesting is sometimes people have great strategies for that they don't apply to other things in their life. So they're able to do it here when they're playing this kind of game is the way they think about it, I think, but they don't necessarily employ those strategies when it comes to doing homework or, whatever it might be. And again, that helps us pave the way for creating more personalized interventions for them or recommendations for kind of how they might want to do things.
Also, what about planning? You said to me once that you see clearly the convergence with Hanoi.
Yeah, no, I like that and figuring out the order that people need to be served in, and whether people can, internalize that set of rules or not. And it's interesting because, again, I often compare performance on ice cream to what I see on the tower test. I like doing both of them. And what I'll sometimes see on the tower test when people struggle with planning on ice cream is that in the tower test, they are placing bigger pieces on top of smaller pieces. They're trying to pick up two pieces at once. Or alternatively, they build the towers correctly and follow the rules, but on the wrong peg. And so it's nice to see those kind of overlaps as, other indications of kind of what's going on. I mean, I'm somebody in my practice who often I like to have more than one measure of the different things that if I'm drawing conclusions, I like to be able to say on this and on this, or on these things they struggle, but not just have this one isolated, this was hard for them, so it must be hard for them in all regards, because that's not necessarily the case. But the planning I do find to be helpful. And I have people who really, likewise, the same thing, who will call up their boss as often as they can to figure out what order am I supposed to do things in, and revisiting that. And sometimes those are the same people who are worried that they're going to do the wrong recipe, and so they check more than they need to.
Yeah, the taking decision variable. Also, for example, I like to see how the kid manage their feeling. For example, I once had a kid when a client taking ice cream threw out an ice cream. He told the client of saying that there are people dying of starvation, that you cannot throw food in the bin, right? So you can see also how they manage their feeling. For example, and how they face up their errors. Rigid people, they need more effort to move on after an error. So I think that this is also useful for diagnosed people who are more obsessive or autism spectrum. What do you think about it?
Yeah, no, I think I actually had somebody who told me that one of the things that was hard for them about ice cream was being told that's not what I ordered. That's not what I wanted. And that upped their anxiety in ways that I didn't see other places. Because so often we don't give people feedback, right? So often, in testing, we just accept their answers and it's right or wrong, but we don't really do much with it. The only place that I can think of besides ice cream that does that, off the top of my head at least, is the Wisconsin card sorting test, where it tells you you've done this right or wrong, but it also doesn't tell you what the rules are either, so you need to figure that out. But those two tests are the only places that off the top of my head I can think of where we give people immediate feedback of, no, that's not right, or you didn't do that correctly. And this particular kid was somebody who that feedback was really anxiety provoking, and it made it harder and harder and harder for him to go on. And he started checking the way he coped with this, he started checking the recipe more often. And so he was going back to the book constantly, more and more and more as the test went on, to try to figure out, how do I avoid getting that negative feedback or the critical feedback?
So I think that overall we have 3 tests to do, not only screening, go deeper in different functions, and also going more in a practice direction. What do you feel about the velocity, the instant report generation? Do you think that the report are able to share with other professional or directly with the family? Are they ready to understand, or do you need to elaborate more?
I don't share. I find the reports really helpful. They make sense to me. I feel like I understand the scales well enough. I usually don't give the actual report to them. I do the interpretation and incorporate the interpretation into my big reports. I'm not sure. I think there are definitely some some learning specialists that I could give that whole report to, and they would be able to make really good use of it. Probably some parents who could make good use of it. But for me, I prefer just to do the interpretation for them and give it to them. But I do feel like I get a lot of good information out of it. There are a couple of scales on Aula that I particularly enjoy, that I really, really like to have at my disposal that we don't get in other CPTs. And the one I'm thinking about in particular is that those last two scales at the very bottom that are looking at visual attention when the headset is facing the board. And I really love that particular scale because what that suggests to me, when that's elevated, meaning that you're missing visual targets, even though we know, because you're in the headset, we know that you're facing the board, what that tells me is that you're not off task necessarily because of something you're hearing or something you're seeing, but rather you're probably in your own head. And that's kind of a third type in some ways of kids that I see with ADHD. I see kids who have a hard time paying attention. I see kids because they get distracted by the auditory and visual things around them. But I also, on occasion, get those kids who get in their own head. An intake question I always ask people is, if you're paying really good attention to something, what's more likely to distract you? Something you hear in the background, something you see out of the corner of your eye? And after they answer that question, then I always follow it up with, okay, so what's going to be more distracting? Something you hear in the background or your own thoughts? And it's kind of interesting because the people who say my own thoughts, what I'll often see is that last scale, those are the ones that are elevated. It's also really interesting to look at the difference between, does it get elevated in the high stimulation part at the beginning where there's lots of responding, or does it get elevated in the second half of the test when it gets kind of slow and boring and maybe you feel like you have more time to let your mind wander and think about whatever it is that's going on. So that I really, really like. I don't want to talk badly about any other products, but I was at a conference. I was exhibiting at a conference a few years ago before COVID, and I was seated next to one of the CPT manufacturers. And I started talking to them when it was kind of quiet, and told them that I used this test, and told them about that scale in particular. And like, oh, you can do that with our test. I'm like, oh, really? How's that work? What do you do? And I thought they were going to have some like scale that somehow they were able to do. Like, oh, you just have to watch them, and if you notice that they're not looking at the screen, that then you know that they're thinking about their own thing. Like, well, that's not the same as what I'm talking about here at all. This is like, we're actually tracking their head movement and keeping track of like how much time are they spending looking where they're supposed to. And I feel like it gives you such rich information. I just think the ecological validity of the whole thing makes it a really, really useful product.
I think so. The ecological validity, I think that it's unique in Nesplora because of the realistic scenario. And also it's about to learn how other tools work to improve it. For example, the integrated open response window for adapt to the patient. Like here at the comment, Alan and McAllister asked us why can be any different between one CPT and another, based on one patient performed better on aquarium than the other CPT. And maybe I can suggest to Alan, because some CPTs have like the stimuli, a fixed open response window. So it takes 1 second for you to answer. And Aquarium adapt to you. If you are quicker, you will have less time. And if you are slow, you will have more time. So it helps to the paradigm to apply. And also it helps to measure properly the processment speed. Because also if you run out of time, you will appear as an impulsive and inattentional patient when probably the problem can be epilepsy or white matter damage, or slow cognitive tempo. Do you have any experience with that, Christopher? Like any especially slow response in kid, but without other attentional problem? Or
I can think of 2 or 3 cases off the top of my head where, what we saw wasn't necessarily a lot of omission or commission errors, but a lot of slow responding. And what we found as we looked through that is that aligned pretty well with some of the other data we had about how quickly this person does things. And it wasn't always reflected in something like coding and symbol search on the whisk, or like an automatic naming task where they have to name something that's right in front of them, but it would show up in places like verbal word fluency on the DCAPs where they had to come up with it out of their own head and it would take them longer, or writing tasks that were timed, things like that. And so it usually fit a pattern. Now the problem sometimes in those situations is then also, what do we do with this? There's not a slow processing speed diagnosis, not in the United States at least. I don't know if there's anything like that in Spain. But here, that can be a difficult child to work with, because you need to figure out, what are we going to call this so that we can get them the additional time that they need, because they might be so far away from meeting an ADHD diagnosis that it's kind of hard to call it that. And so then it's figuring out, this person obviously needs time. Now, I work with a lot of independent schools, private schools, and frequently they're willing to provide some accommodations because they're smaller institutions. They're often willing to provide some accommodations without a diagnosis. But by the time those kids are getting older into high school and you need extended time on something like the ACT or the SAT, if there's still no diagnosis, but it takes them a long time, it's going to be hard to get them those sorts of extended time accommodations on those tests. So that is challenging because we don't have a category for them, unfortunately.
Yeah, sometimes the category is difficult to deal with because the tag can make a super rigid way or path for a kid when sometimes it's not about it. But not only tagging, like understanding this problem and having a good measure about it, because other tests cannot show with precision the processing speed. So you can sometimes have a bit of mess mixing the results. So I think that it can be good if you have two different CPTs and you can compare or even corroborate your results, and that's why it can be different.
I think all of that speaks also to the role that these tests can play in selecting personalized interventions. I mean, one of the things that kind of drives me nuts is when I see reports from practitioners where the diagnosis is ADHD, so they've copy and pasted their 15 ADHD recommendations into the report. Some of those might not be appropriate for this kid's particular presentation of attention symptoms. And, between Aula, Aquarium, Ice Cream, I feel like I can get some information that justifies particular, more specific interventions. So, I'm looking at omission errors versus commission errors and auditory versus visual, and what does that mean about where we might want to try to seat a student in a classroom, or what does that mean about the kind of study environment that this kid should be working in at home? When I see lots of visual commission errors, one of the things I almost always tell the parents is, we really probably don't want to have this child doing his homework at the dining room table or the kitchen counter. There's probably too much going on there that's going to be distractions. He is apt to click on the visual targets, the visual non-targets. And if we put him into an environment where there's lots of visual distractions around him, he's more likely to get off task. And so let's find like a low distraction environment for him. Let's have him work at a desk that faces a wall, not a window or a door. You see a lot of auditory commission errors, then I'll talk to them about we need to find some ways to reduce some of the environmental sounds that are there. And it might be really hard to eliminate all those sounds because there's too much going on in the world for us to eliminate them. So maybe instead of trying to make it quiet, maybe we introduce white noise into the environment to try to mask some of those sounds so that, their brain, which looks like it probably perks up to things that it hears in the background, has a little bit more room to operate in where those distractions won't become quite so prominent. And so that's the other place where I find some of the more in-depth evaluation or assessment of the results becomes really helpful in terms of what's going to really be meaningful to this person. Um,
Yeah, I totally agree. Also, here there is another comment from Olga. She's wondering about do you recommend to assess Aula or Aquarium in the middle of in a waiting time of a memory test, like Suite or another between the short-term task and the long-term memory task? Or do you think that it have a lot of cognitive, it's that much challenging? Do you need more session to
I, yeah, I don't have very much experience using Suite. I've played with it just a little bit on my own. I haven't actually used it with people because I have a love affair going on with the RAML 3, and Suite has a couple of things in it that I really like, but I haven't incorporated it into my evaluation yet. What I like about it that no one else really seems. I mean, there is a instrument from Cambridge that does this, but I've never seen it in the United States or used it. But Suite does have that measure of prospective memory, which I really like. I think that's something that's missing in a lot of memory instruments, is that ability. And I have a lot of clients, but that's one of the complaints. It's not so much that I can't remember things that you've told me or that I've seen in the past, but I can't remember what homework I'm supposed to do tonight. And I don't know how robust that measure is necessarily on Suite because I know it's not based on too much data. It's just based on a couple of points, but it is something though. But big picture, I haven't used it much, so I can't really comment on that. What are you supposed to, a 15 to 20 minute gap between the two of them? Is that what you guys recommend? Yeah.
no?
I mean, I suppose you could do that. For me, that feels like a lot of time maybe on the VR. And honestly, I like to spread it out a little bit across my different visits with my clients so that it becomes a bit more of a treat for at least the younger kids. I think they often feel like, oh, I get to do that part now. So I might split it up just for that purpose. But I don't know. Do you all have recommendations for?
It depends of the patient. Like for example, if the patient have actually experience with VR, I think it's possible. But if his first experience or it like their feelings, if it is frustrated because aquarium was challenging, Suite was challenging, I won't put aquarium because I think that it will be too much. But if I feel him relaxed, maybe it can be a good idea to save time. I think that it depends of the case. Also, Gerard asked us, okay, about Wechsler scale, symbol search and coding tend to reflect visual scanning more than processing speed as such. Are there any instruments on Nesplora that can overcome this shortcoming?
Yeah, Gerard, I completely agree with you. I mean, I view symbol search as a visual scanning task and coding as a psychomotor speed task. And those can be helpful depending on what kinds of processing speed difficulties people have. But we said earlier, I think before you got here, maybe that, that's not always telling the whole story. And the response time scales and then that standard deviation of the response time can be really helpful, I think, in terms of looking at speed. Beyond the Aula or Aquarium, there are speed scores that are incorporated into into Ice Cream, and I find those to be really useful because that's a more cognitively demanding task, and I think gives you a better sense as to how quickly can people do these more challenging exercises, and might be more reflective of their ability to sit down and complete a test within standard time, or if they need more time to do things like that. So it can be a nice complement from my perspective to some of the academic fluency subtests that I might give off of the Wyatt.
Also here, Juan Rango asked to us, do you have any idea of how introduce Aula or Aquarium or Ice Cream to American professional for them to use it?
I don't know this for sure, but I might be the most successful Nesplora unpaid salesperson in the United States. I've had a bunch of people, ask me over the years about it because they hear me talk about it at a presentation, or someone's reached out to me because they read the chapter in the book. In the school neuropsychology training program that I'm part of, I do a lecture in that about assessing attention and ADHD. And so those students will ask about it. And I think in the last year, 3 or 4 people, maybe 5 people, which I know isn't huge, but I think 3 or 4 or 5 people have have jumped into the Nesplora pool with me after those conversations. I would say, if you have opportunities to do presentations locally in your area, talk about the tools that you use. I always do. And I think it's fascinating and helpful. And I mean, this webinar, as I understand it, is going to be, is being recorded, and it'll be posted as part of your video blog, so people can watch that. You can point them in that direction. I'm doing that attention lecture in October for our training program, and I'm going to give them a link to that if you'll give that to me, Miguel, so that if people want to, dive a little deeper into that, because there's always a lot of questions about the product, way more than I have time to do in this presentation that I do in October. So I'm going to make sure that people have, access to this if they want to learn a little bit more about it. And the other webinars you have are probably helpful too, I would imagine.
I agree, because I think we must to share the good practice, because certain tools are useful, but it's not only about preference, it's also about psychometric quality and properties. For example, Aula and Aquarium have a 0 per 90 and 97 Chromback alpha. And it's being demonstrated in several sensitive empirical studies that this does like 97% of distinguish between control group and people who actually have a diagnosis. So this is important because it's also about to improve our way to treat people. And that's the other reason why you are here. You are a successful clinician, and we are proud of you use our tool. So.
Well, I think, the other thing that I think would be useful for more American practitioners to understand is, and this is a conversation you and I have had before, Miguel, that there's not an awful lot of culture embedded in attentional functioning, as opposed to what you might see with like the comprehension subtests on the WISC or something like that, where embedded cultural aspects will influence the way people respond. Here, from what I understand from research and from conversations I've had, is that you're not seeing a lot of cultural influence on people's ability to respond when they're supposed to and ignore when they're supposed to. And I think that's probably something that maybe more American practitioners need to hear, is that, yeah, you can use this. It's not a Spanish test. It's a test that was developed in Spain. And that's probably another message that those of you who use the product already could be, spreading a little bit as you have opportunities to talk about it.
Yeah, because you are you have to prove that it's good and it makes sense, the results with actually the problem or disorder that the kid could have. You can confirm about the sensibility of the test. So I think that if anyone have another question, we are here to respond everything. If not, I think that it's been a great time. I enjoyed always to talk with you. So here we admire your work, and we let in the chat the reference to the book. If Amalia, could you text it again for the English people? And I want to say thank you to everyone for coming to the webinar, and try to make more with the next release.
I'm really glad to be here, and I really, this is these play a really big role in my evaluations. I believe strongly in them, and I think they do exactly what I need and want them to do. And so it does make my work easier too. And I can't say enough good things about Nesplora and the work that you all have done. So we can be in this like mutual admiration society with each other. And yeah, if there are any other questions, I'm going to stick around for a bit, but I'm really, I'm glad to have been here and had a chance to talk for a little while.